I was just interviewed by the LA Times regarding the vaccine conversation that's happening right now. Today, the Advisory Committee on Immunization Practices from the CDC is voting about specific vaccines. They wanted to talk about the hepatitis B vaccine, and I thought we should have a conversation because wherever you are, this affects all of us. What is hepatitis B? It is a virus that can lead to hepatitis, which is liver inflammation, which can develop into things like liver cirrhosis, liver cancer, and even needing a liver transplant. So one important thing that we do in public health, what I want everyone to understand is we are having a conversation one-on-one, but public health is a conversation that's macro level, which is what sorts of things can we do to help the whole village, because every child is important and the village is important. What we're trying to prevent is, yes, vertical transmission from mother, and so a lot of moms ask, if I tested negative, does my child still even need the vaccine? This is why it's so important to have an informed decision, because yes, you might test negative, but there are a host of things that could happen that could still put your child at risk. What are those things? Well, you could still be technically positive, but the test can't pick it up because you're still seronegative. You haven't built up enough viral load for the test to pick it up. If God told us that you don't have hepatitis, sure, that's one thing, but the test is not perfect, and the test might say that you don't have it, but you actually have it, and so you actually are exposing your child whom you love, and we love as well. There could be a documentation error. It takes two to tango. There could be dad at home, and dad could be exposing the child as well. There could be siblings. There could be people in daycare who are exposing the child. So because hepatitis B can be transmitted not just vertically but horizontally, so we want to protect as many people as possible by creating a love bubble around the baby. That's what we call it. We found that the vaccine does protect babies at rates of 90%, over 90%, which sounds like pretty good odds, and countries like China have implemented it, and within one generation of implementation, they've gone down from like 15% of hepatitis B to less than 1% in their pediatric population. Your baby is gonna be impacted by your decision. If you don't vaccinate them, you have to understand the risk that you're putting onto them. The doctors and the nurses and people who actually swear it, we will do everything we can for your child regardless if they're vaccinated or not. It's really important for us to have holistic village conversations that yes, your child is your choice. You choosing to or not vaccinate your child puts your child at risk with other kids around them. And there are some kids who cannot get vaccinated because they're immunocompromised. So by building enough bubbles of love, one kid who can't get immunized, they're still protected, that we are still able to protect people on a massive scale from these infections, and using evidence to make decisions, one-on-one care, while also being mindful of the whole village that it takes to raise your child.